Last year, I began following a promising cancer drug candidate, AOH1996, a name that became a symbol of hope for many. My YouTube channel, as some of you remember, was built not just to report on medicine, but to offer a hope line for people waiting on that one breakthrough to reach phase 2 and eventually become a cure. AOH996 is not just another compound in a test tube. It's a small molecule inhibitor targeting a special form of PCNA, a protein essential for DNA repair. But this isn't just any version of PCNA. This is kPCNA, a cancer-associated isoform found primarily in tumor cells and largely absent in healthy tissue. That distinction? That's the razor's edge between healing and hurting. By going after kPCNA, scientists at City of Hope in California may have found a way to arrest cancer cell division while sparing the body's normal functions. A kind of precision strike we've long dreamed of in oncology. In laboratory testing, AOH996 didn't just slow cancer cell growth. It triggered cell cycle arrest, apoptosis, and showed no toxic side effects in animal models, even at doses 6 times higher than required. And most notably, it left healthy cells untouched. It has the potential to be used alone or as part of a combination therapy. And the story behind its name? It was named after Anna Olivia Healy, a young girl who passed from neuroblastoma in 2006. Phase 1 clinical trials were underway at City of Hope as of last August. I had expected, like many of you, to see results by September. I reached out, no official answers yet. But I'm still watching, I'm still hoping, and I know many of you are too. Meanwhile, while I waited, I was building something of my own. For the past 5 years, I've been immersed in the cutting edges of quantum computing and artificial intelligence. Through trial, failure, and an unstoppable curiosity, I built something I now call an Entropy Pipeline. A system that taps into the randomness of the quantum world, harvesting it and injecting it into simulations. Sounds abstract? It isn't. In my case, I first used this entropy pipeline to develop a quantum tornado prediction system, one that forecasts atmospheric collapse zones hours ahead of classical models. It's real, it's running, and it works. And now, I've turned that same system toward cancer. So, how exactly does it help? Here's how. My entropy pipeline injects true quantum randomness, not pseudo-random numbers from classical algorithms, into massive simulation engines. In cancer drug discovery, that means I can run thousands, even millions of compound-to-target simulations, seeded with entropy from real quantum sources like QRNG hardware or annealing results from D-Wave. I'm not just screening drugs. I'm watching collapse zones form between molecules and proteins in both wild-type and mutated cancer forms like P53, EGFR, or KRAS, the monsters behind aggressive cancers. Each simulation reveals not just a chemical match, but a collapse signature, a moment where quantum uncertainty becomes biochemical binding. I've trained an AI to recognize those collapse patterns and assign symbolic meaning using my Zabany Quantum Glyph Dictionary, a visual symbolic overlay to track promising compounds in a sea of noise. This isn't just brute force drug screening. This is quantum-guided intuition at scale. And unlike traditional labs, I run this system on home PCs, with entropy streamed from quantum machines, proving that you don't need a billion-dollar supercomputer to contribute to humanity's greatest medical challenge. I'm not claiming to have the cure yet, but I am actively looking into graph neural networks, GNN, pushing the limits of AI, quantum entropy injection into my simulations. Time will tell. And I believe I've built a system that could help find it. A system that doesn't just simulate molecules, but deciphers meaning in their collapse. AOH1996 lit a fire under many of us. Patients, scientists, families, and dreamers. I intend to keep that flame alive. And if you believe in science, if you believe that answers sometimes come from the edges, then follow me on this journey. Because sometimes the cure isn't made in a lab. Sometimes it's born in the space between chaos and collapse. You can follow my progress at Quantum Tavern and kick the tire yourself.